This is the Lone Crater YouTube. We hope this video helps.
You start by assessing the problem and prioritizing safety. Check when the floppiness began and whether both sides are affected. Pay attention to signs of infection such as pain, discharge, or odor, because those change the approach. Once you have that information, make an appointment with a qualified clinician or veterinarian so they can confirm diagnosis and rule out underlying causes. This step sets the plan and prevents harm, so focus on accurate observations rather than attempting fixes yourself. Next, review non-invasive options with your provider and understand why each is recommended. Conservative measures, such as observation, guided physical therapy, or ear molding in very young patients, aim to reshape tissue without surgery. The clinician will explain expected timelines and success rates. If the cause is structural or unknown, diagnostic imaging or specialist referral clarifies the problem. Make sure to ask about risks and realistic outcomes, because choosing the right timing and method depends on age, severity, and medical history. Finally, decide on a professional plan and commit to follow-up. Once the clinician prescribes conservative treatment or refers you for intervention, follow their schedule and track progress with photos and notes. Make sure to report any new pain, swelling, drainage, or functional changes promptly. If progress stalls or the condition worsens, escalate to the specialist who can recommend procedural options. A single troubleshooting rule: stop home attempts and consult your clinician if you see signs of infection or deterioration.
Thanks for watching. Consider subscribing if we helped you.